Hypnotic therapy: what happens when the mind enters a different state? For centuries, hypnosis has occupied an intriguing space between medicine, psychology, and popular culture. On stage, it has been presented as a spectacle in which ordinary people appear to lose control of their behavior. In films, hypnotists are often portrayed as mysterious figures capable of manipulating minds with a few carefully chosen words. Yet beyond these dramatic images lies a far more nuanced practice: hypnotic therapy, sometimes called hypnotherapy. At its simplest, hypnotic therapy involves guiding a person into a deeply focused and relaxed state while using carefully structured suggestions to address particular psychological or behavioral problems. Contrary to a common misconception, hypnosis does not usually mean falling unconscious or surrendering control. People undergoing hypnosis are generally aware of their surroundings and can reject suggestions they find unacceptable. So, what actually happens to the mind? During hypnosis, attention becomes unusually concentrated. Everyday distractions may fade into the background, allowing a person to focus more intensely on particular thoughts, images, or sensations. This state can resemble the experience of becoming completely absorbed in a book, film, or piece of music. You remain aware of yourself, yet your attention is directed so strongly towards one experience that everything else seems less important. Therapists may use this heightened concentration to encourage changes in the way people respond to certain thoughts, memories, or habits. For example, someone struggling with a fear of flying might be guided to imagine an aircraft journey while remaining calm and physically relaxed. The aim is not simply to tell the person that flying is safe, but to help them develop a different emotional response to the situation. This is where hypnotic therapy becomes particularly fascinating. Human behavior is not governed by conscious reasoning alone. Much of what we do is influenced by learned associations. A particular smell can suddenly bring back a childhood memory. The sound of an alarm can produce anxiety before we have consciously considered why. A person who has repeatedly experienced fear in a particular situation may eventually react almost automatically. Hypnotic techniques attempt to work with these patterns by combining focused attention, relaxation, and suggestion. Depending on the problem, a therapist might help a person reinterpret an experience, develop more constructive mental associations, or rehearse a desired behavior. Some people also use hypnotherapy as an aid in managing pain, anxiety, stress, or unwanted habits. However, the subject remains surrounded by exaggeration. Hypnosis is not a magical key that unlocks the hidden depths of the mind, nor can a competent therapist simply take control of another person's will. The spectacular claims associated with stage hypnosis can create a misleading impression of what therapeutic hypnosis actually involves. There is also an important distinction between hypnotic therapy and conventional medical treatment. Hypnotherapy is not a universal solution, and its effectiveness can vary considerably depending on the individual and the problem being addressed. For some conditions, it may be useful as part of a broader treatment program rather than as a replacement for established medical or psychological care. Perhaps the most interesting aspect of hypnosis, therefore, is not the idea that someone can be controlled by another person, but the opposite: how flexible human attention can be. Our minds constantly filter enormous amounts of information, deciding what deserves our awareness and what can remain unnoticed. Hypnosis appears to demonstrate just how dramatically that focus can be altered. Hypnotic therapy is less about mysterious powers and more about the relationship between attention, expectation, memory, and behavior. The science is still developing, and many questions remain about precisely how hypnotic states work. But one thing is clear: the human mind is capable of entering surprisingly different modes of awareness, and understanding those states may tell us much about how we think, feel, and change.